Have you ever wondered how doctors diagnose brain and spinal conditions? From detecting tumors to measuring a brain activity, neurosurgical investigations play a critical role in modern medicine. In this video, we will break down different types of tests, including cerebrospinal fluid analysis, CT scans, MRI, EEG, and more. Let's get started. Let's start with cerebrospinal fluid examination. CSF is the fluid that surrounds the brain and the spinal cord, and it can provide essential clues about infections, bleeding, and neurological diseases. So how is CSF collected? So we have first lumbar puncture. Which is the most common method where a needle is inserted between the lower back, between L3, L4, here. L3, L4 is the safest area to insert the needle without hurting spinal cord. The second method for CSF collection is cisternal puncture. Cisternal puncture, which is less common and taken from the base of the skull, approximately below the cerebellum. The third way for CSF collection is ventricular puncture. Directly from the brain's ventricle, usually is in hospital setting, because it's just sensitive location within the brain. So why do doctors examine CSF? Another way we can say, what are the indications for CSF? You can keep with this mnemonic, MISS MRI. So M stands for meningitis, while S stands for subarachnoid hemorrhage. M here stands for two things, for multiple sclerosis and for malignancy, while R stands for radiological images, and the last is I, which stands for intracranial pressure. Okay, what about the contraindications for CSF collection? In other words, when not to do a lumbar puncture? The first contraindication is that when the patient has increased intracranial pressure. The second contraindication is when there is superficial infection here on the skin, and when we insert the needle for CSF collection, that will lead for entrance of these bacteria or viral infection into the CSF. So one of the contraindication is the presence of local infection at the site of puncture insertion. The third contraindication is when the patient has a bleeding disorder. That's mean when we insert the needle, that will lead to bleeding. Imaging is one of the most important tools in neurosurgery. Let's compare the three most commonly used techniques: X-ray, CT scan, and MRI. Let's start with X-ray. X-ray is basic but limited. It's used for skull fracture, as we see here. This is fracture revealed by X-ray. It is used for spinal injuries also. It can show bone erosions from tumors, but doesn't show soft tissues like the brain. So it's only restricted for the bones. What about CT scan? CT scan is fast and effective. Different densities on CT images are related to the X-ray attenuation properties of the tissue being examined, and it can be quantified in Household units. These range from 1000 for bone to -1000 for air, with water being defined as 0 Housefield unit. Denser tissues such as bone, foreign bodies appears white on CT, and less dense tissues such as air, water appears black. The addition of contrast makes tissues that enhance appear more dense or white. It is best for detecting a brain hemorrhage such as epidural or subdural hematomas, used to diagnose skull fractures also, and the brain swelling after trauma. It can detect hydrocephalus fluid, and it's important to mention that it uses radiation, so it is not ideal for long-term monitoring. But generally, it tends to detect the bone. What about MRI? It is best for soft tissues. It provides detailed images of the brain and the spinal cord. It is best for tumors, spinal cord compression, and brainstem conditions, which are soft tissues. And also there is no radiation, so it's safer for repeated scans. But one of the disadvantages for MRI is that it takes longer time than CT and is not suitable for patients with metal implants such as pacemaker, metal plates. So when to use MRI instead of CT scan? If the doctor suspects a brain tumor or multiple sclerosis, if the problem is in the brain stem or the spinal cord, as we said, it tends to the soft tissues, not like CT scan and X-ray. If a patient has had a stroke, because MRI detects infarction earlier than CT, there are what's called functional investigation. So besides imaging, neurosurgeons also use tests that measure brain and nerve activity. This includes EEG, which stands for electroencephalogram. It's similar to ECG, electrocardiogram, but instead is for the brain, and EMG, which is electromyography. EEG, it measures electrical activity in the brain, so it's used to diagnose epilepsy and seizure disorder. It can detect brain dysfunction and encephalitis, while EMG and nerve conduction studies measures electrical activity in muscles, helps diagnose nerve injuries and neuropathies and muscle disease. Angiography, blood vessel imaging, helps detect brain aneurysm and arteriovenous malformation. It can be used to guide neurosurgical procedures. PET scan, brain function imaging, detect brain tumors and epilepsy, used to assess brain metabolism and blood flow, while ultrasound is for babies, used in a newborn through the fontanelle. As we know, in infants, the fontanelle soft supports in the skull, helps in guiding your brain surgeries. To summarize, neurosurgical investigations help doctors diagnose and treat brain and spinal conditions. We covered CSF analysis, radiology tests like CT and MRI, functional tests like EEG and MEG, and advanced techniques like angiography and PET scans. Never miss a medical breakdowns like this. Thank you for watching and see you in the next video.